Thank you.
Thank you. Okay, so can you guys all hear me? We're trying the wireless. Can you guys hear me okay? Yeah. All right, good. Then we won't worry, and we won't blast your ears out that way too much. All right, so I know this is a rough time of day. It's 3:15, and even the last speaker, as fascinating as all that was, I could see a lot of people going. So I know I won't take it personally, and in fact, me standing up here, I'll try not to just like narcolepsy out and fall asleep on the stage. But I'm here to just tell you a little about we've all been there, right? And the bunnies wait until 3 in the morning to have some kind of crisis. And you can't get your vet, or it's a Sunday, or your vet is in Alaska or something. And as I'll warn everybody, right, I'm a Mac person, I tell everybody who's in the IT, so forgive me if I mess up the slides, but this information, that's not my cartoon, I liked it though. The information I'm going to present to you today obviously is not meant to replace a visit to the vet. This is just what you can do to make your rabbit survive until you get to the vet and make your bunny more comfortable. We got reformatting going on here. Okay, so these are just for temporary supportive care, and in fact some of the procedures that I'm going to talk about, probably you should go over them with your vet in advance. Get prior instruction, get prior approval. Some of you will have vets who are more amenable to allowing you to treat your rabbit than others, and that's not something I can really address today. We're really fortunate in Miami to have wonderful vets who work with us and allow us to have things where we can suture and do all kinds of things at 3 in the morning when the bunnies use it. So what are the potential things that you could see? And this is on a partial list. Rabbits have all kinds of ways to invent to try to die when you're unable to reach anyone to help you. One of these is acute infection. Acute just means sudden onset. Per acute means really sudden onset. So this can happen all of a sudden and you don't perhaps know a reason, but it's there and you need to deal with it. I get a lot of questions about eye injuries, and these are usually not life-threatening emergencies, but they're something that are painful and you can help short-term. Obviously, we've talked a lot about intestinal distress today, so we'll cover that. Head tilt, also known as torticollis or Rhineck, or any other technical terms you can come up with. And then there's respiratory distress. This is really scary when suddenly your bunny can't breathe, and I ask my students, what's your favorite bodily function? And they always come up with the obvious, dirty answers. But it's like, how about breathing? What would you be most unhappy about having stopped? Because they agree that your breathing is probably tops there. And then wounds, trauma, broken bones. All of these things could face you, and they do need the help of a vet, but sometimes you need to do some emergency care before you can get there. So there's you. Okay, so if you can't find your vet, obviously the first thing you need to do is, okay? All right, upstage me, that's fine. We don't want to activate now. There, okay. Okay, so leave a message for your vet or even the emergency clinic, somebody who can at least help you get hold of prescription medications should you need them, who can help you. Oh, don't start working on me now. Ah, that's funny. It was working a minute ago. IT guy. Right, we'll just do the click. All right. Even that's not working. How special. Oh, there you go. Okay. I'm just using my click. If you want to look at this and see if it's got a dead battery or something, or did I turn it off by accident? Okay. So you need to take your bunny's temperature. This comes on up and down online sometimes, and oh, I turned it off. Told you I was going to fall asleep. So take your bunny's temperature. You need to learn to do this. There are some people who say, oh, you can kill them, you can perforate the rectum. Not if you do it right. And definitely you need to learn how. We'll do a little bit of that. Listen for gut sounds. That alone, sometimes you can get the bunny's gut moving again and everything seems fine. And then keep the bunny in a quiet, and you'll notice I say temperature appropriate place. I don't say warm because we live in Florida And sometimes keeping them in a warm place is exactly what you don't want to do. If the bunny is hyperthermic, too hot, you want to keep them in a relatively cooler spot. And if they're overheated, if they're too cold, you want to keep them warm. So just whatever is appropriate for the situation depending on their temperature. So how can you tell they're sick? You guys all know. I don't need to tell you that if your bunny is suddenly lethargic, there's something going on. Lack of appetite, that's often the first sign. The bunny looks okay. You remember, of course, that these are prey animals. This is nothing anybody doesn't know. They hide their signs of illness because their evolutionary history tells them that if they show the signs that they're sick, the predator is going to pick them out and bye, you're out of the gene pool. So they've been selected naturally and artificially maybe for not showing signs of illness. So if they're not eating, if they don't want to take their regular food, you can take little bits of fresh herbs that they really like and nip off the end so they smell really fresh and just kind of sneak it into their nose. And if they don't want to take that, a favorite treat, like a little Flako oatmeal. And if they don't take that, you know it's trouble. Sometimes they'll sit hunched up in an unusual place and they get that look on their face. You know the look where the little whisker muffs are kind of puffed up and pulled back a little bit and their eyes are a little bit wincy. And only a good bunny mom or dad can really tell that. When you got real trouble going, sometimes you'll see this. The bunny will act agitated and then reach down and just start licking their tummy and licking their flanks excessively. And that means there's something painful going on in the abdomen, and that can be a sign of big trouble. They'll also, sometimes along with sitting hunched in unusual places, they'll be quiet and then suddenly you hear this really awful crunch, really slow crunch. It's nothing like a tooth purr. You guys all know what a tooth purr sounds like. This you can hear from across the room a lot of times, and that means they're really unhappy. This we're going to address if the body temperature is high or low, and it's really critical, I think, to be able to take their temperature, because that will tell you a little bit about what might be going on. Your normal temperature should range between 101 and 103. I would consider it emergency if it's anything under 100 degrees or over 104. A little fever, it's probably not life-threatening, but it's going to tell you there's something going on, infection, heat stroke, many different reasons for that. Okay, so there are several things you should be able to do and learn how to do before you need them. And one is the critical thing, safely take a temperature. And a lot of people think that you can get those ear thermometers and stick them in the ear. Those are good readouts. So we're gonna do the old-fashioned way. Listen for the intestinal sounds. You need to learn how to administer subcutaneous fluids. If you do, how many people already know how to do that? Okay, so I don't need to tell you. You need to learn how to disinfect and stabilize wounds. I'll explain that a little bit more, but let me just say at the outset, a lot of people writing to me say, yeah, I put peroxide and neosporin on it. It's like, nah. Really dilute povidone iodine. If you just take some lukewarm water, squish some into a cup and make it like the color of dilute tea, that's a good concentration to use. Use some clean gauze sponges. Peroxide is very caustic. It's going to kill the tissues and can, impede healing. And neosporin, I am not a big fan. I think it's great for superficial wounds like scrapes and urine scald. But if you've got bacteria in a wound, that gooey Vaseline base is going to seal things in, and I just don't like neosporin for wounds. You want to keep the wound clean and dry. Now, administering pain meds can make all the difference in the world to a bunny. But you need to be able to get advance permission from your vet, have meds on hand, know the dose for your bunnies to make them feel better. So it's also important to realize that certain conditions you may not want to give certain pain medications. So this is something that's a little dicey, and you should discuss this with your vet before you go on that. So let's talk about taking a temperature. How many people here know how to take a bunny's temperature? Okay, not all the hands went up, so I guess this is good. You guys who raised your hand, you can stop me and correct me if I'm wrong. Which, by the way, I like to run lectures more like they're living room discussions. So if at any point during this conversation we're having, you have questions or comments, just raise your hand and we can do it that way. And if I go over without finishing the talk, now so be it. We'll talk about that. But I think it's really important to address your questions as you have them. So, temperature. Okay, the first thing you want to use, flexible plastic thermometer. I don't even think they sell glass ones anymore. and certainly not a mercury thermometer. When I took over our labs at the University of Miami, I opened a drawer and there are always mercury thermometers. So we replaced those quickly with the mineral spirits ones. They're safe, so don't ever get mercury near your bunny. It's really important to make this a pleasant experience, or at least a bearable one for the bunny. So lubricate the tip. You can use your personal lubricant of choice. We actually, for a while, we were going through a lot of this, and I went to Publix, and I had like a case of 12. It was like, the cashier's like, good for you. All right. Out there. Okay. So, rapid temperature taking is a little odd because most people who don't have bunnies don't realize how the spine curves underneath the bum, and then the tail kind of makes a quick U-turn and goes straight up, and the rectum and the anus go like straight parallel to that. So when you take a temperature, you have to kind of keep that in mind. Oh, I hit the wrong button. Okay, so there's your bunny on the back. You would too get a red arrow going up the butt. So kind of straight down. Now there are videos. We have a video that shows how to get an enema, and that's quite similar to this actually. Christy, where's Christy? She's like the sexy voice narrating our enema video, which is appropriate, right? But it's the same kind of direction. You've seen one already. I think there was a talk showing that the little opening closer to the head, that's the genital opening, and the one right behind that's kind of muscular and winks at you, that's the anus, that's the one you want to take the temperature. More than one person has tried to take a vulva temperature that doesn't work. I mean, it could work, and maybe your bunny will then have a false pregnancy, I don't know. Okay, so if your bunny has a temperature higher than normal, a couple of the things that are commonly seen is that there could be an infection going on, or if you live in a hot climate, the bunny could be suffering from heat stroke. You can quickly lower, you don't want to do it too quickly, you don't want to shock the bunny, but you can lower the body temperature several different ways. One is by taking isopropanol, just rubbing alcohol on a little cotton ball and rubbing the back of the ears where all the big blood vessels are, and blowing on it and just cooling with convective cooling. Rubbing alcohol is kind of nasty. It will go away and there's nothing nasty that they will lick off, but you can also do that with water if you don't have rubbing alcohol available. We also, if the bunny is really hot, and we've occasionally had a bunny where the thermometer just went to the top and it was off the scale. Really not a good surprise to have in the middle of the night. Ice packs. We always have some in the freezer, and the gel packs are really nice because they're flexible. You can also use them as heating pads if you want to. And the places that work best to cool down the bunny are the abdomen, where there's not a whole lot of muscle mass that's interfering with the blood flow. And then right here, like behind the neck and on the shoulders, I find that rubbing the forehead with an ice cube often makes the bunny feel a little better, because in a fever, they sometimes get a massive headache. I don't know, you can't ask them how they feel, but it seems to make them feel better just from the signs they give us. The one thing you want to be careful using ice, don't give anybody frostbite. You could do that. Make sure you're not keeping the ice on the ears or the delicate exposed tissues so long that they get really, really cold. Just do this gradually and be careful. While you're doing this, it's important to, every 5 minutes or so, unfortunately, take that temperature again, because you don't want to overshoot your goal and bring the bunny too far in the other direction. It can take a while to do this. You have to be patient. Sometimes a bunny who has a fever will take an hour to get them down into the normal range. Same thing with a hypothermic bunny. That body sometimes just does not want to warm up. And there are other things that we can do that I'll talk about it in a second. A hypothermic bunny, sometimes they're shocky, and you don't necessarily know why. I'm not diagnosing anything, obviously. It's just like my bunny's temperature is too low. What could be wrong? I mean, bunnies could be shocky. And really important to note that until you get that body temperature in a normal range, the other treatments you're going to try and medications are not going to be metabolized or working properly. So the first order of business is to get that body temperature up to normal. I as I said, anything lower than 100 degrees Fahrenheit is cause for concern. We like to use the gel packs that you can, they're either hot or cold, you just stick them in the microwave and put those on the abdomen. How many folks here have like expired bottles of saline or plasmolite or anything like that? Those are great for using as heat packs. What we'll do is get a little bit of gentian violet or methylene blue and squirt it in there so you know it's a water bag from now on. And just stick those in the microwave. If you have a couple of them, you put them on either side of the bunny and a towel wrapped around the bunny. Monitor to make sure it doesn't get too hot, and you want to pad both sides with toweling, but just gradually bring that temperature up. We call the little warm wrap bottles warmies, because we like to use adorable terms when we're doing things for bunnies. Okay, so on the ears too, like if we have it on the shoulders, the warmy pack, I sometimes put the rabbit's ears on the warm pack from above and just kind of hold it gently down there. Questions? Yes?
Gentian violet's pretty scary. Where do you use it?
Oh yeah, food color too. I just like gentian violet because it's pretty. And so is methylene blue, and they don't fade. So yeah, you can use food coloring. Those just will fade over time. All right, to warm up a bunny sometimes, and I'll cover this again when we do fluids, if the bunny's really cold, you can bring up the temperature a little more quickly by using sub-Q fluids that have been warmed. But again, you don't want to be too warm. I guess rule of thumb is test the fluids on your wrist as you would baby formula. If it feels hot enough to burn you, then that's too hot. If it feels cold enough that you go, ooh, then probably it's too cool to use for cooling down a warm bunny. It's probably better if you don't know what's wrong to keep things just external, yeah.
How do you warm sub-Q fluid?
Oh, we put them in the microwave.
You do just microwave them?
Yeah, we do.
You know, maybe kind of shake them or...
Well, okay. We usually get our sub-Q fluids in a 60 cc syringe with a very short catheter and stick that in the microwave for like 6 seconds. And then you shake it up and test it on your wrist and ready to go. Yeah.
What also works well are we use rice socks.
Oh yeah, those are good too. A nice clean old gym sock filled with any kind of rice, and you stick that in the microwave. That'll hold heat for a nice long time, and it's flexy. So those are good too. Mary had.
Yeah, if you use a sub-Q fluid bag, which I use a bag rather than easier, be careful when you warm it to let enough run out through the hosing to make sure that the temperature you're feeling is from a heated bag, not from the cool fluid going to the hose.
Right.
It goes through the hosing, it gets cool. So you can be easily fooled if you think it's real comfortable for the rabbit, and you can burn the rabbit badly if you overheated the bag.
Yeah, that's one reason we like to use the syringes, because you can tell a little bit better if the temperature's really right.
Now, I was recently told by some vets that you don't warm fluids in the microwave because it breaks down not the plastic, but the fluids themselves. Like if you're doing like a normal or plasmolite, it breaks down the...
Well, I don't know. Well, I mean, I wouldn't think a salt would dissociate. I mean, have you ever heard of that?
No.
I don't know. Okay, George. Okay, the answer from our pharmacologist is no, that's nonsense. You do want to have fresh fluids. You don't want to have, obviously, you hold up the bag, make sure there's no flocculent material in there. If you've used it before, make sure it's nice and clean. Yes?
I used to put them in the microwave too, and then had a couple of accidents. So what I do is I just get like a mixing bowl or something with water, throw that in the microwave and warm that up pretty good, and then put the bag in there and squish it around a little bit, and that generally
Takes a little
warms it
longer,
up.
but yeah, that works.
Yeah.
Anything that's safe. You just don't want to burn your bunny because you're putting it under the skin.
Another good way to test the temperature of the fluid is with the thermometer.
Yeah, old-fashioned way, right? Yeah, I mean, I used to do that for baby formula. I would say like nothing. They used to really like it at 107.
I mean, until you get the feel for it.
Yeah, you know, I hope you never have to use these things, but you know, the more you deal with emergencies, the better you get at just getting the whole gestalt of the wonderful experience of trying to get your bunny not to die till you get him to the vet. All right, the other one is listening for intestinal sounds. Sometimes when a bunny acts sick, it could simply be because the GI tract, for any number of reasons, has decided to shut down. It's so worthwhile to invest in one of these. You can get them, they're not very expensive. but you get what you pay for. So if you deal with a lot of bunnies, this will be your friend. Just get a nice stethoscope. And if you're not familiar with listening to gut sounds, listen to healthy bunnies once in a while. Put your stethoscope up there, listen way back on the abdomen so you don't hear respiration and heartbeat instead, and you'll hear that little of a happy gut. And then when you put the stethoscope up against a silent one, it's a terrible sound, that abysmal silent. Listen to both sides, because there's more loops on the intestine on one side than the other. And listen, don't just go, nope. Give it 15, 20 seconds, because sometimes they're not completely shut down, they just be kind of sluggish. And you want to know what the situation is with the gut if you can. All right, we've all had this, again, I'm telling you probably nothing you don't already know, but ileus, or the stopping of normal peristaltic movement of the intestine. You guys don't know what peristalsis is, right? Raise your hand if you do. Good. If you don't, it's the muscular movement of your intestine that constricts and pushes food through. Ileus means that has stopped. And I can tell you from personal experience, post-op, it is one of the nastiest, most uncomfortable things in the whole world. You don't really know what's happening at first, and I don't know if a bunny goes through the same experience. Anybody here who's had ileus post-op can probably, you have too. And I'll tell you a great way that even my doctors were surprised to combat that. You don't even realize it's happening first, but just looking at food makes you want to throw up. You don't have any other signs, it's like, oh, gross. And it could be your favorite thing. And then the pain starts, because then your microbes in your gut start producing gas and they're not going anywhere, and it just gets worse and worse than the cramping, and it's just absolutely awful. And that alone, I mean, a bunny's pain response, more ileus, and it just can circle and spiral until it gets really out of control. But the ileus is not a disease. It's a reaction to something. It's reaction to a high fever event, an infection, a stress event, moving to a new house. I mean, it can be so many different things, it's hard to enumerate them all. But it can make things worse. So if after you know what the temperature of the bunny is, the next thing I would do right away is check for gut sounds. And make sure that things get moving again. Now, there are things you can do to reverse ileus until you get your bunny to the vet for if your vet thinks that medications are necessary, and mainly to diagnose what it was that triggered the ileus in the first place, but at least get the bunny more comfortable. Pediatric simethicone drops, that's something everybody should have on hand. They're inert, they're gentle. It doesn't take much to turn a big foamy gut into something that has bigger bubbles that are easier for whatever peristalsis is there to push through. I think even the biggest bunny, we did some experiments with this, it just takes a tiny drop to disperse bubbles, so like half a cc or even a cc if you really want to go overboard. It's only need even for a big bunny. Abdominal massage can not only just make the bunny feel better, but it can sometimes stimulate gut movement. So if your doctor has ileus, the first thing they tell you is get around and move around. Move your gut. Hold your sides of your gut and move it back and forth. So if you do that to your bunny, they love it. At first, they're like, what are you doing? And then, oh, that feels better. And you'll notice they're leaning into you and going, oh, no, you missed a spot. So they enjoy that, and you know that's good. Another thing you can try is, you'll notice I picked a nice G-rated one. It helps to have KY jelly. Okay, never mind. The electric massager, the big flat head, is nice because you can place it on the side and it vibrates a big area. Sometimes for baby bunnies, you may want to have a smaller one, but these seem to work really well. The electric, the battery-operated ones aren't usually as strong. You can test out different models, see what you like. And then the controversial, okay, I don't know how in detail I should go about this enema, but I will tell you some things about it. Okay, enema. When some vets have heard about this idea, they just freak out. Are you crazy? Blah, bunny will explode and die. So far, I've never seen a bunny explode and die from an enema. The way we do it, we use lukewarm water. You never want to use extreme temperatures on these, so you have to be very careful, especially cold. And well lubricated. We use a little pediatric ear bowl. These are available anywhere, Walgreens, CVS, whatever, and our old friend KY jelly, or whatever lubricant you want to use. We have an instructional video that I wanted to show you that's narrated by Christy, and it's me in tie-dye showing with Zuma being a very sweet model who just sits there going, okay, whatever, you want, just poke me with the tube. And we can't get internet in here, so unfortunately I can't show it to you. But I can describe a few things. The video's really much better. All right, well, we'll just go on ahead. If you guys want to ask me questions about the enema later, that's fine. But bottom line, I discovered this by accident. I had a bunny back in the 1980s, tells you how old I am, and many of you have been there too, who I know now in retrospect had dental problems. He had little swellings, and I would massage him, and then somebody popped it, and he'd go, oh shoot, an abscess. But I was a college student, I had no idea what was going on. And he constantly got constipated. So I thought, well, what do you do for constipation? You give someone an enema. And within minutes of my administering an enema to this bunny who was suffering chronic ileus, he would start producing poops. And so later on, years later, decades later, I started trying this with some other bunnies. And then I don't know if you are going to suffer post-op ileus or ileus for any reason. I won't tell you I tried this myself because that would be getting too personal, but it works. I heard from someone. My doctor didn't believe me. It works. Okay. Another couple of things you should be able to do. You guys mostly know how to administer subcutaneous fluids. I don't think I need to teach you the basics of tenting and going into the base of the tent. You know all of that. But just a few details. You can give warm sub-Q fluids to bring a cold bunny up to normal body temperature. But again, this is one of those things that try the external warming first because you don't want to be administering fluids if you don't really know what's wrong. You can also bring cool fluids in to bring a fevering bunny to normal body temperature. Just probably everybody's familiar with this too, that average total need of your basic mammal is about 100 milliliters per kilogram per day, and that includes what they eat in their food. A dehydrated bunny obviously will get a little more. You don't want to give that all at once. Usually most of the vets I know recommend 3 doses, 3 boluses a day, several hours apart over the course of the day, so you don't want to overload to a dangerous level. Wounds is something, we have multiple rabbits. People stick their noses through bars where they shouldn't be, and suddenly there's a nose hanging off like a flap. We are very fortunate in Miami that we have, my dad was a vascular surgeon, and one day he decided it was time to teach me how to suture. So he was tying flies at his desk, and he said, oh, come over here, let me show you how to do this. So I was very grateful he showed me how to do that, and our wonderful vets have supplied us with local anesthetic, but this is not something, unfortunately, most everybody can do. So until you can get your bunny to the vet to get a wound properly fixed, if the wound is superficial, you don't need to do much. It's not a bad idea to trim the fur away from it while it's still damp so that it doesn't adhere to the surface of the wound. Be really careful when you do this. Obviously, you don't want to be cutting the wound and making it bigger. My friend, dilute povidone iodine is, to me, the best disinfectant. Chlorhexidine flush is also really nice. You have to get that at the vet. Usually they'll give that to you over the counter. It's good to have on hand.
You can buy that from Dr. Foster and Samantha Katie Vet Supply. Or
Okay, some of the online places can do it now. They used to be able to get it at places like Petco and PetSmart, but now you can't. So, yeah, you have to get it from a veterinary supply or your vet. Keep the wound nice and dry. If it's a superficial little thing, you may not need to worry, but sometimes you'll get a bunny who does something stupid, they'll get in a fight, you come out and there's this gaping, gigantic wound and there's muscle underneath, you can see it. How many people have ever seen that happen? It does. What did you do? You got to the vet, right? Yeah, it's an unfortunate situation. You take him to the vet. Well, if your vet's not there, you've got a problem. If you have a gaping wound, you don't want it to dry out. So it's really critical. First, of course, disinfect well with your povidone iodine tea with a clean gauze sponges. And then you can pat it dry. It's not a bad idea to have some of this good stuff on hand, and have your vet, ask your vet if it's okay to do this. If you have an emergency, I don't know, you have to take your, make your own judgment, but this stuff, it's kind of pricey. It's like between 20 and 30 bucks for a little tube, and sometimes in between uses, the whole thing will solidify and become useless, so maybe get a couple of them to have on hand. What we do is take a toothpick and put a little bit of the glue out on a piece of aluminum foil, take little tiny bits of the glue, and only on the very edges of the wound, you put little beads of glue, and then press it together. If the wound is under high tension, it may not stay together. It's not ideal, because really the best thing to do with a wound like that is get them to the vet. But if you can't for several hours, if it's the middle of the night, at least it will hold things together, and the muscle tissue below won't dry out and cause more problems and have the wound have to granulate forever.
Just don't stick your finger to the wound.
Yeah, be careful not to put yours, yeah, that's definitely, you have your fingers all stuck together. It's like, oh, doctor, can you take me apart too?
How are you supposed to keep it from drying out if you don't do that?
You could probably put wet povidone iodine soaked gauze right on the wound. There are also some gels that you could put on there. What do you think, Peter? Could you put KY with povidone iodine on there? Just slather it, just keep it wet. KY would be good. Yeah, just, you know, the real important thing is to not let it dry out. If the wound is deep, like a puncture wound or a really deep laceration, you don't want to be messing with it and gluing it or anything. Flush it if you can. If it's bleeding, let it bleed. It's good to flush things out. It will pull out some of the bacteria if it's a white bite wound. Then cover it with the clean, moist gauze, and just keep the bunny quiet and immobile so he doesn't work it and open the wound further until you can get him to the vet. Okay, so what happened here? All right, pain medication. Again, hello. Yes. The aliens have landed.
I came in one morning and two bunnies that had a terrible, terrible fight. Ultimately, one needed 110 stitches and one needed 90 stitches. When I say terrible fight, I mean blood.
That's a good one, okay.
So, yeah. So I got two people holding bunnies together and we just drove at high speed to the vet. Should I have done anything other than that?
If you have a vet who's available to do it, that's the best thing to do. Just get them to the vet. This is if you can't find your vet.
Yeah. I mean, I just got there. I didn't
that
know
would be
what else to
panic
do. I
time.
just wrapped it up.
Yeah, that would be, I mean, if you couldn't get them to the vet, I suppose you could try and gauze wrap, like have gauze wrap and push the wounds together as much as possible so that all those wounds aren't going to be drying out by the time you get them to the vet. Because if there's a lot of exposed open muscle tissue and stuff, they can die shock from that. So yeah, you got to cover them up and make sure they're not going to go shocky on you.
This is Kathleen from Maryland. I mean, there are a lot of things that it's not worth it to go to the emergency vet if they don't know rabbits.
That's the problem.
But with wounds, I would think even a dog and cat vet would
The only
deal
thing,
with that.
yeah, the only thing I'd caution you is that sometimes if it's something really bad like that, a lot of the vets will want to put them under anesthesia to suture them up. And a bunny that's already, A, they don't know rabbit anesthesia very well, and B, a bunny like that, we saw a wonderful talk at NEDC, it was a couple of years ago, where, I wish I could remember the doctor's name, but she gave a talk on why are you putting these severely compromised animals under full general anesthesia with little exotics like rabbits. Oftentimes good sedation and local anesthesia is quite sufficient to allow you to suture things up and you don't have the risk of anesthesia. That's like for fly strike too. I've heard so many people, there's extensive fly strike all around the back of a bunny. The bunny gets put under anesthesia and dies. I would never put a fly struck bunny under anesthesia, never. I would give them sedation, I would wash it, you know, it's going to be painful no matter what, but the anesthesia, just every time I've ever heard of it, it's been like a kiss of death. So yeah, fly strike is not an emergency I covered here, but we could talk about it. I've had quite a bit of unfortunate, we have a lot of bunnies come in Miami with the hot climate with fly strike. Okay, eye injuries is a favorite of our household. I'm not quite sure why. I borrowed Rami's nice picture there. This is from MediRabbit, and this is a healthy rabbit eye. oftentimes the only sign you'll see at first is that suddenly the eye starts running. And you can't see any obvious injury. Later, if you don't treat a corneal injury, the cornea can become cloudy. That's what happens when the cornea undergoes edema or swelling. And that's a sign that there's trouble. It could be any number of things. Oftentimes there's a corneal ulcer for some reason. This one is particularly interesting. You'll notice how it's kind of horizontal. You'll see that in a bunny oftentimes who can't fully close the eye. And they're not blinking and closing it efficiently and keeping it lubricated, so the eye is drying out with these horizontal corneal lesions. And so not only are you dealing with a corneal problem, you're dealing with some underlying problem. It could be something like a thymoma that's making the eyes bulge a little bit and the eye can't fully close, a retrobulbar abscess, dental problems in the back. Neurological things that are interfering with the normal blinking. So sometimes an eye emergency can signal something more serious underlying that you will have to deal with later. The bunny might be keeping the eye partially closed, like wincing and in a little bit of discomfort. And when you try and touch around the eye, they'll go, and ordinarily they don't do that. Those are all little signs you can use to see. Really the eyes are something you don't want to mess with too much. A lot of times it's nothing more than just a foreign body. So another thing for your bunny emergency kit would be sterile saline ophthalmic solution. Be sure not to get contact lens cleansing solution. It looks the same on the label. They're right next to each other on the shelf because people buy both. Don't accidentally get that. Make sure it's sterile, saline, buffered, physiological, good stuff. And it's usually a two-person job, but you have to hold the eyelid out a little bit so it makes a little cup and flush the lower lid, and then hold the upper lid up and flush like a little hose. You want to warm it up a little tiny bit. Again, we use the microwave, chick, chick, chick on your wrist to make sure it's not a bad temperature. And that will at least remove a foreign body and help rinse things out. That's supposed to say no ointments or creams, but because this is a PC, not a Mac, it messed it up. So we have a wonderful veterinary ophthalmologist down in Miami, Dr. Lorraine Karpinski, and she put me on to a lot of this, so I thank her for a lot of this advice. When your bunny has an eye injury, some people say, well, I have this eye ointment that I had for my pink eye, can I use that on the bunny? You don't want to use anything like that, not only because you don't know if it's appropriate, but also if the cornea actually has an open lesion, you don't want to be getting ointment in the anterior chamber of the eye. So just stick with the sterile saline and you won't do any more damage. That's not going to hurt anything. And if possible, pain medication is a good, nice thing to have. One little note on these things, a lot of bunnies with eye injuries, a corneal ulcer or lesion will often elicit spasms of the muscles inside the eye, the ciliary body. You can actually, people will say you can't, but you can use atropine drops to stop those cramps. They won't last as long as in many other species because a lot of rabbits have atropinase, which breaks down the atropine, but it works for a little while. And it makes them feel better, at least until you can get to the vet, if you have atropine on hand, which, it's not too hard if you ask your vet. Just make sure that your vet advises you on what is and isn't okay. And just to give you this is one of our jackrabbits. Raisin just showed up a couple of weeks ago with her eye completely cloudy. The day before she was fine, and suddenly she was like that. It looked like there was flocculent stuff inside the anterior chamber. It was like, oh great, what did you do? So our wonderful vet ophthalmologist, Dr. Karpinski, prescribed antibiotic drops. And here's a surprise for you. One of the things she always prescribes for something like this is Monistat. You take a little bit of Monistat on a Q-tip, just the regular yeast infection cream, and you put that in the eye, and that takes care of any fungal opportunistic pathogens that might be in there. And just a little bit of pain management, and here she is. This is sometimes people won't notice an eye injury until it's already healing. Has anybody here ever seen a bunny show up with like a bright red maraschino cherry eye? That's actually a good thing. Because one of the first things a bunny will start to do if it's getting a normal healing response is it'll start to vascularize from the sclera back here and over the cornea. Until it fully does that, you'll need to put in eye drops to get the antibiotic to the rest of the area. But once it's fully vascularized, you can see it even more here. I don't know how close, but see, she's growing blood vessels down towards her pupil. And once there are blood vessels, then the systemic antibiotics you're giving her aren't reaching the cornea and going to be able to keep it bacteria-free. And I've actually seen rabbits with the whole eye covered with blood vessels, and when it's ready to go, they recede, they go away, and the eye is healed. It's amazing. And that's what you'll eventually see. Sometimes you see a little scar left over where the lesion was, but I had a vet look, we had another jackrabbit whose eye looked like a cauliflower. This just happened over the course of a day. He said, well, we're going to have to enucleate the eye, we're going to have to remove it. I said, let's go to the ophthalmologist. So I showed it to Dr. Karpinski. She said, well, maybe some vets shouldn't be practicing veterinary ophthalmology without being boarded. So she prescribed the antibiotic and all that stuff, and her eye healed up beautifully. So even really severe eye injuries, don't give up. They are so treatable, and they're very rewarding. Yeah.
Well, say for adding lubrication, it's a little more expensive, but getting the single dose saline drops, where you just...
Yeah, you can do that, then you don't waste a whole bottle.
And it's also, you don't have to worry as much about sterility.
Yeah, exactly. So yeah, you can buy the little ones. It is a lot, well, not a lot more expensive, but yeah, the little single dose, and they just throw it away. You don't have to worry about contamination, because you don't be throwing more bacteria in their eye. All right, here's the big one everybody knows about, intestinal distress. There are so many things that can go wrong with a bunny's gut. They're basically a little mammal wrapped around a gut that wants to go wrong. Really rarely you'll see true diarrhea in a rabbit. Most of the time the mushy poops that we've talked about today, that's cecal droppings or cecotropes that have just become mushy because of microbial imbalance. But once in a while you'll have true severe diarrhea, and that's usually secondary to something else, like a super high fever or a really severe parasite infection. In adult rabbits, you almost never see this. If you do, we found that as an emergency measure, if this rabbit is just spraying its gut contents out and just dehydrating itself to death, you can use Imodium to just stop the diarrhea. And we've used it at 1 mg per kg, which is a really high dose, but at lower doses didn't work. And that will at least stop the diarrhea until you can get the bunny to the vet. Subcutaneous fluids are really important when a bunny has severe runny stool because they're losing a lot of liquid. Oral liquids are often not going to be absorbed well if the gut is compromised and the gut lining isn't reabsorbing fluids. Again, don't give them tons of fluid. Consult with your vet beforehand. Know the dose that's appropriate. Usually no more than 1/3 of that 100 ml per kg dose every few hours to avoid problems. Monitor the body temperature. When somebody's squirting out their life down the back end, they're oftentimes circling the drain in other ways. So keep close watch on other vital signs, and surely get the bunny to the vet as fast as you can once you've controlled that diarrhea. In babies, it can be fatal really fast. In some of the rescue wild bunnies we've seen, and in little infant domestics, sometimes you'll just see a little sign of runny stool, and then 8 hours later they're dead. And it's not because of dehydration necessarily. It's the first sign of intestinal bacterial infection is this true diarrhea. We found from culturing poops from bunnies like this, we used to call it the green death, and that's what a lot of wildlife rehabbers call it, because this runny diarrhea is green and it smells like snake poop. It's just awful. And I had several vets tell me, oh, that's what coccidiosis smells like. I cultured for coccidia and none of them had it, but they all had massive overgrowth of E. coli. Baby bunnies who aren't getting mother's milk colostrum are very susceptible to the potential pathogens we have all over us. You've got E. coli all over you, no matter how clean you think you are. We are walking balls of poop. So I never let a baby bunny lick my hands. Before I handle a baby bunny, I always put peroxide all over myself, surgical scrub, just prevent as much as I can. And we haven't had too much trouble. If you do see, and this is going to be, the vets in here are going to freak out over this, but this is something I started trying out of desperation with baby jackrabbits that I had because they were continually just green death and they were gone. So I said, okay, if it's overgrowth of E. coli, what's going to kill E. coli? Cipro. Don't use anything injectable. You want to go straight to the lumen of the gut where the pathogens are. So we gave them oral Cipro, and yes, I know Cipro can interfere with the cartilage formation of baby animals, but if they're going to die anyway, you might as well have fluby-jointed surviving babies. And actually, we've never seen any lasting effects on any of the babies that we've had with this. Other supportive care, of course, Imodium, again, to stop that diarrhea, subcute fluids to keep them hydrated, pain management, gas drops, because a lot of times the gas will be so painful they just give up and die. If it is coccidiosis, your vet will be able to do a fecal and prescribe either panazeryl, toltrazeril, or maybe some of the potentiated sulfas, but these emergency things will keep bunny alive. Sometimes we see E. coli secondary or accompanying as a copathogen to coccidiosis, so the Cipro could help. But again, that's going to have to be something you and your vet work out in advance. Supportive care, like we said before, subcute fluid and pain management. All right, gastric bloat. Has anybody here had to deal with gastric bloat? There was a question back there. Sorry.
On the oral ciprofloxacin, do you end up dosing them any differently than adults?
What do you mean by
Or
what dose do we use?
Yeah.
We use anywhere between 10 and 20 mg per kg, which is really high. But if that bunny is circling the drain, you almost have nothing to lose. You want to really hit those pathogens hard and not leave any survivors. So a lot of you have dealt with gastric bloat. It's a very unpleasant thing, and it is an extreme emergency. It happens when the pyloric sphincter oftentimes is blocked. This sphincter caudal to the stomach for some reason gets blocked. It should not be confused with somewhat less deadly intestinal blockage. Sometimes the intestines get blockages in them, but you don't get a bloat. The bunny will be very unhappy and licking the abdomen, and sometimes you can actually palpate the loops of the intestines and feel a big mass, and especially in the English spot bunnies. Where's Susan? Is she out here? She's at another top. Oh, there she is. You can feel those massive abnormal poops in the gut, and sometimes you can help massage them through. It's not the same as a gastric bloat. The intestinal blockage is a little more operable. The bloat, oof, we don't want to see it. Liquid and gas can't get out of the stomach, so the stomach starts to expand to ridiculous proportions, causing extreme pain, difficulty breathing. Eventually the stomach will rupture, and you have cardiac arrest. Sometimes the bunny doesn't even make it to stomach rupture, and they die. And it's not happy. Sometimes if you see the early signs of a bloat, I know a few cases where people said, that bunny is bloating. And they immediately take measures. And one of the weird measures, let me just show you the anatomy of the stomach. So this is what we're talking. In rabbits, and this was something Mary Cotter put me onto, so thank you, Mary. And I guess was it Gil that, or you just, the intestine just caudal to the pyloric sphincter takes a real sharp turn. So if the stomach gets bloated a little bit, it can pinch that off, and then you're off to the races, and then you can't fix it. But, and this is another something that Mary's little great trick, where is it? Oh, these are from MediRabbit, thank you, Rami. This is a healthy radiogram. This is a normal stomach, and there's your distended stomach in a bloat. And that's not going to be a bunny who's probably going to survive. Early stage, they're just kind of restless, agitated, moving around from side to side, and they show abdominal discomfort, signs that they're licking the abdomen. You start to notice the abdomen swelling as this progresses, and then the late stage is just hugely swollen. It's like tumescent. You can ping it like a drum. It's like a watermelon, and the rabbit is panting and in extreme distress and just can't do anything about it. If you catch it in the early stage, that's really the key to survival. And this was Mary's trick. This is, if you take the bunny and turn the bunny on her left side, and it kind of helps the kink to relieve a little bit of pressure on the kink, which is up on the right side. And if you kind of massage from below, it can help move things if there's not if it's not a solid blockage. And, you know, if you're lucky, it could open a little passageways for some of that fluid and gas to get out, and you can save the bunny. At least you get to the vet, but this is definitely a bad situation. I'll really quickly go through the rest of this because I don't want to go too over time, but head tilt, we've all seen it. neck, head tilt. Quick diagnosis is critical. It's not a life-threatening emergency when it's first onset, but if you have a bunny that all of a sudden you come home and there's this bunny rolling and just like in a seizure position on the floor, it could be a middle or inner ear infection, it could be echiniculi, less commonly it could be a lesion in the brain, but to keep the bunny safe until you get him to the vet, just put him in a quiet, temperature-appropriate place. If the bunny's rolling, padded carrier, just lots of towels all around, and keep bunny quiet. And if the down eye is scraping on things, you don't want to add corneal injury to insult. You can actually use a little bit of paper tape and take the eye and close it and just make sure the eye is not going to be physically injured. You have to be real careful, of course, not to put tape on the eye, but that can help protect the eye before you, or just put gauze on it, and that won't necessarily keep the eyelids shut, though. Yeah. Yes, who is it? Who said yes, I think? Yes.
I just wanted to say about bloat that I'm a little more optimistic than you are.
Oh, good.
You seem to have good success if they're brought in early, but just what you said, this one is the emergency. If you go to the vet, if your emergency vet can handle rabbit, go there, because decompressing that stomach fast is life-saving. My own rabbit bloated a month ago
Oh,
at 8 in the morning.
Oh,
I
Lord.
took her in and worked on her all day, couldn't get her unbloated by 4. She was in surgery,
oh wow.
and now she's fine.
Oh my gosh. Did you find out what was blocking her?
In her case, it was a small hairball. It was just right outside of her.
Wow.
But I think that the gastric surgery is not as dangerous as intestinal surgery, because it goes to the stomach. And most clients survive with medical management.
Yay. Well, we've got the good rabbit vets in here, so I'm not talking about you guys. But certainly, yeah, maybe those days are past too, where rabbits have to die from gastric bloat. If you get them to someone who knows what they're doing, like Dr. Harvey, then hey, do that if you can, immediately. Respiratory, do we have to, I can stop now, if anybody has, because we're like past our time. Yeah.
Donna, can I just say really quick about the, when you're creating the padded environment for the rabbit who's fully rolling, to make sure it's not towels with any kind of loops on them.
Oh yeah, very good point.
Got her, toe.
Yeah, you don't, make sure it's a nice towel with no holes, no threads. You don't want somebody wrapping up a limb or a neck or anything in anything like that and causing really bad injury, which can happen. So breathing, open mouth, nose in the air, extreme emergency. We don't have time to do this, but okay, anyway. I don't want to impinge on the other, what should I do? Just keep going? All right, I'll do it as fast as I can. One thing that I've seen people do that are inexperienced, we had these little kids on our block and they came running because they knew we had rabbits. They have this little bunny who can't breathe and they're holding her on her back. It's like they were feeding the bunny on its back and the bunny aspirated. And like the worst thing you can do, I know I saw a lot of slides with people holding bunnies recovering from surgery like a human baby with their on their back. No, really hold them. I really prefer them on their external in their natural position because it's just, to me, asking for trouble, spit going down there, whatever. But you can check for obstructions in the nose if you can reach in the mouth, but oftentimes it's not that. But don't turn the bunny over if you can help it. We found it's helpful to hold the bunny with the nose downward, and that helps gravity pull things down out of the trachea if there's an obstruction. And in an extreme case, if your bunny can't breathe and your bunny's going to die in the next 2 minutes, you can try the bunny Heimlich. Now, this is not something, I've done this, and it saved the bunny's life, but you have to realize that it's dangerous. And this is a little volunteer donor that I got from next door. You have to be so sure that this bunny's spine is stabilized and can't move. This is not a perfect position, but your bunny is dying, can't breathe. If you hold the bunny like this and do a swinging motion like that, don't hit the bunny's head on the ground. That movement of the organs pushing up against the diaphragm, it's like a Heimlich. And I had a bunny who was dying, and he dislodged whatever with his mouth. He came up, he was like, and then he just started eating again, like the John Elizabeth Taylor sketch. It was, those who laughed, I know how old you are. Yeah, yes.
Oh, I was going to say, I had emailed you a couple of years ago because I had a special needs bunny who had started choking. And I emailed you, you told me about doing the bunny time, was pretty joy actually.
Yeah.
And I had to do it on her a couple of times.
Yeah.
To save her life.
Oh my gosh.
And it saved her life.
Yeah.
Every 3 or 4 times.
Yeah, when your choice is death or breaking your back, yeah, you're gonna die either way, right? So yeah. So if practice on a toy bunny so that when it actually happens to you, you'll be freaking out anyway, but you won't maybe freak out as much. I hope you never have to use it. Sometimes it's just severe pneumonia. If you don't have a nebulizer, get the bunny in a warm, steamy room. Try some coupage on the ribs to help open up the airways. Just keep bunny comfortable until you can get one to the vet. And then trauma, blah, blah, blah. Broken nails, you know how to do that. Black bleeding, blah, blah, blah. Styptic pencils. You can do sugar if you don't have a styptic pencil. Broken bones, oh gosh. All right, well, you guys probably have done. Okay, so follow up. Once again, anytime your bunny has an emergency like that, this is just temporary. Get the bunny to the vet to see what happened. And even if the bunny seems fine, I would not just assume everything's okay. I would get the bunny to the vet and make sure everything's okay. There's a little list of bunny emergency kit stuff here and here. And that's it.